Hello, my name is Betty, and I'll be covering some background information about clinical document exchange, and then I'll talk about the responder role. We'll talk a little bit about what clinical document exchange is and how it works. We'll discuss patient consent and how the practice records this for the practice as a whole and for individuals. Clinical document exchange is sometimes referred to as care summary exchange or continuity of care document, CCD. This allows different healthcare organizations to exchange clinical documents. It's a system of standards for how these documents are shared. There are 3 steps that make up clinical document exchange. The first step is patient discovery. Through PCC EHR, the user at the practice will query a third party to see if they have records on a specific patient. In step 2, we'll locate the documents. If the patient exists in the third party system, we'll take a look to see what documents are available for that patient. In step 3, we'll retrieve those documents, and the user will select the documents that they want to retrieve from the third party. As I mentioned in the beginning, there are 2 parts to this interface, the responder role and the initiator role. In the responder role, the other organizations in the care quality network can retrieve clinical documents from your practice without your intervention at all. They can query your practice on specific patient records. In the initiator role, your practice can query other organizations for documents on a specific patient. Only organizations registered with Care Quality can query for and retrieve clinical documents. And Care Quality has vetted these organizations as legitimate entities in healthcare before authorizing them to participate in the exchange. Your patient's documents can only be retrieved for treatment purposes. And we will talk about how to configure the practice's patient consent settings to either allow or not allow sharing patient documents in a few minutes. There is a website. Care Quality has a web page that lists their search engine. So you can go to the Care Quality site and look for organizations in your area that participate in the Care Quality Exchange. To give you an idea of the kinds of documents that your practice can make available, when patient consent is set to yes, 1 summary of care document per patient is available for retrieval. And that summary of care document contains demographic data, clinical data, diagnoses, allergies, medications, history of procedures, diagnostic and lab test results, history of immunizations, insurance policies. Confidential diagnoses and orders will not be shared unless the summary of care settings in the patient record are changed by the practice in the summary of care configuration tool, which we're going to go over in a couple slides. When your practice goes live with clinical document exchange, PCC will set the consent status for all of your existing patients. So your practice's consent policy for CDE determines the status of the patients that are existing in your system. Opt-in patient data will only be shared if and when the patient has given explicit consent. If your practice is opt-in, all of your existing patients will be defaulted to opt-out until you manually change their setting to be able to share. Opt-out patient data will be shared unless and until a patient explicitly revokes consent. So if your practice is opt-out, all of your existing patients will default to opt-in until you manually change that to revoke sharing. Your practice should consider state-specific laws and requirements regarding patient consent. There's no official consent form, but we will share some examples of consent documents. It's up to the practice to make the decision based on whatever is required by your state. So if you're participating in clinical document exchange, the Care Quality requires that the practice record patient consent in PCC EHR. The consent status will determine whether a patient's clinical data can be retrieved by another organization. Clinical documents can only be retrieved when consent is marked to yes. And there are a couple places where we set consent in the EHR. Once the practice goes live with CDE, the practice can record consent on a patient-by-patient basis. In the patient chart under demographics, communications preferences, clinical document exchange consent, and you'll see over here, share clinical documents. You can change this setting by clicking the edit button and then clicking the edit button on the chart and then going in and changing the radio button over on this side. The second place we record consent in PCC EHR is in practice preferences. This is where you will set the consent for new patients that are added to PCC EHR after your go live. So this setting can be changed in practice preferences on the settings tab. The status is set to undetermined by default. If your policy is opt-in, you will want new patients to be created with a no consent status. So new patients would default to not consent until they let you know that they do want to share that information. If your policy is opt-out, you will want new patients to be created with a yes consent status. So new patients would default to consent to share that information. All right. And if your practice wanted to collect consent data prior to your go live date, clinical document exchange consent can be enabled manually in protocols, component builder, under a chart-wide components in communication preferences. A practice that has decided to use an opt-in policy for CDE might want to do this. PCC uses multiple layers of security in compliance with care quality standards to protect patient data. We encrypt data that is transmitted to other care quality enabled organizations, and you need to contact PCC immediately if you become aware of a data breach or believe that patient data has been compromised. So in next steps, we would confirm your practice's consent policy. We can also discuss workflows around practice policy or consent forms and confirm a go live date. Under our list of resources, we include a resource for state law consent policies. Different states have different regulations on patient consent. We also have resources for communicating the practice's consent policy to your patients and how you might want to design your consent procedures at your practice. This is some sample verbiage for practices that are opt-in or opt-out. There is no standard for opt-in or opt-out consent notification. It's practice specific. And PCC recommends that you check with your legal team before making changes to your consent policy. And that wraps up our training on the responder role for clinical document exchange.